Wow, thank you. Another moment of inspiration. I get the pleasure of moderating this panel, and we've already, of course, introduced Dr. Ghaly. Let me take a moment to introduce our other panelist here, Senator Susan Eggman, Talamantes Eggman. Senator Eggman was the preeminent mental health leader of the legislature during her time. A licensed clinical social worker, a military veteran. She chose to take on some of the hardest issues confronting California when it came to behavioral health. Served how many years in total in the legislature, Susan? 12 years in the legislature. Was the author of Proposition 1. Was the author of the controversial but important bill changing the conservatorship definition. Was the author of the End of Life Act, among many other contributions to this field. And so I want to thank you for being here today. Along with,
yeah, thank you very much for asking me.
Of course. So this is going to be your conversation, and I think what I want to do is work backwards a little bit, because I want to talk about how this all came to be. But I want to work backwards because Governor Newsom has only a number of months left in his administration. And the legislature changes. There's a new Senate pro tem. The legislature is always changing. This issue has been a priority for the last half decade or more. How do we sustain this progress? And what is embedded in the laws that we have passed and the decisions that have been made by the executive branch that are going to ensure that we sustain that progress?
I'll start. Again, thank you very much for asking me. I'm glad to be here today. I think one of the things that we changed in addition to the laws is I think we changed the conversations. And I think that is very difficult to go back from, right? I think, right, since we passed LPS back in the 60s, we've had one conversation. And over time, and when I first entered the legislature in 2012, Governor Brown was still the governor, and I came in as a mental health provider and was ready to really take some things on, and it was a no-go. I mean, I couldn't even get hearings on some of the things that I was trying, right? I couldn't get out of my own house of origin. Didn't mean we stopped, right? Because you kept having those conversations time after time after time. And I think then when Governor Newsom came in, and with the pandemic, then we really saw changes in the streets, changes in the conditions and people were living, changes in the 60 years of not treating people where they were really resulted in a massive crisis that we saw played out on our streets that became so visceral and visceral that I think the citizens were saying we have to do something different. And I think a lot of our old conversations about this is how we treat people, this is the right way, everybody has to have their own say, it was too late to the conversation because people may have opted for treatment way sooner, but by the time they progressed to where we were seeing, I mean, again, very visually, the public was very rightfully so saying we have to do better. And so I think, and Governor Newsom coming in and recognizing that, being a former mayor, and hiring the fantastic, we couldn't have done any of it without Dr. Ghaly, hiring the fantastic Dr. Ghaly and the team, we were able to change those conversations from the bottom and the top, and I think they really met in the middle, and I don't think you can back away from that.
Thank you. Dr. Ghaly, we're going to get to the challenges in a minute, but what gives you confidence that what you have done with your team and the legislature is going to continue and grow over the course of time once the administration changes?
So if I have anything, it's not a lazy confidence. I think we're going to have to earn it, right? And I think it comes from words that were already said about implementation. It's going to take everyone in this room and thousands, tens of thousands of others, wherever they work in this system, to keep sort of pushing forward. And I really think in this same half a decade, we moved from a place where you could get away with just talking about it to now you have to demonstrate it. You have to prove it. You got to have the data. You have to show some of the outcomes. And we're talking about showing outcomes in places that aren't used to being either accountable for the outcomes or even know what those outcomes should be quite yet. So we have a lot of work to do in this space to make sure we implement what has been started. And I say started, even though it feels like many years in the making, it really is just getting started, right? I talk to folks all the time who say, that program that you were a part of 3 years ago, we're just finally getting it started. And it is both frustrating that it takes so long, but hopeful because we are just getting started. And the opportunity for impact and influence is great, but we're going to have to earn it. And I think earning it comes not just through being smarter about how we do it, finding wonderful folks to help us continue to build the team to do it, but it's going to take a lot more partnership, I think. And I know we're going to talk about some of the challenges, and partnership is a challenge, but it's also one of the key opportunities, I think, to get this to really be sticky and move forward.
I want to come back to that in a moment, but now I want to go back to the beginning because I think everyone loves to hear a good story. And lawmaking is, and laws are complex and, and sometimes intricate and arcane, but they're made by real human beings. How did this all come to be? Take us behind the curtain. What was going on in the legislature as you were developing your agenda, Senator Eggman, and certainly what was going on in the early days of the Newsom administration? Did you have a 6-year plan? Was it something that was just sort of iterative over time? I remember, digress for a moment, that in Governor Newsom's first year, he came over to the Institute, and we talked about modernizing the Mental Health Services Act because we thought it needed to be improved. And it took some time to get there. We did get there. But tell us some stories. Take us behind the curtain about how this movement over the last 6 years started, both in the legislature and in the governor's office. Tell us, something that nobody knows.
Susan will set the ground rules for how much I can share, and then I'll follow suit.
Well, again, it's been a long journey, and I, all of you have been in the room. All of you have been in the room on the praying side, on the hoping side, on the suggesting side, on the implementation side, on the frustration side. And I think as legislators, and on the family side too, I see family members in here, and let us never forget the families and the people directly impacted as we talk about this. It is a journey. I don't know how else to say it. It was not until I was trying to get some changes into the conservatorship law in 2016. We couldn't get any hearings. Governor Newsom won in what year?
He came in 19.
In 19. Because I would say, not that I've been working by myself, but I had been really beating the drum. And again, I had spent 8 years in the legislature, 8 years in the assembly, and done some pretty big legislation, like an end-of-life option act, so I was able to build up a little bit of credibility and have people listen to you. And again, by the time we were in 2018, going into 2019, things were getting kind of desperate on the streets, right? We had a lot of unrest and social upheaval. And I think it just became the time when crisis creates possibilities. Chaos creates possibilities. And it was when I was going into the Senate in 2020, and we had a lot of very deep conversations. We had a lot of strategic plannings. We had a lot of...
You two spent a lot of time together?
We spent quite a bit of time together. He likes to say hand in glove.
What restaurant did you go to? What
It was
What,
2020.
decaf-
We were
decaf
zooming.
or regular
We
coffee?
were zooming all this time. Don't forget all of that. We did this. Like I didn't even know. Like JC over here, I didn't know she was tall until after we passed the CARE Act. I didn't know people were tall. Like I didn't know. A lot of it was done. But that's when the planning came together, right? We knew, I knew, I don't think anyone thought we could actually reform conservatorship, but we knew we had to go as far as we could. And so we started with care court, right? And that, again, we wanted to talk about things that still need a lot of work. I will acknowledge, because that's what I get interviewed on the most now that the governor has a bigger perch, people want to pick. People want to pick. And I think the care court needs work, but I think it is still a valuable tool. And once we get the full system implemented, hopefully it'll be a more functional tool, But we put together Prop 1 and everything. Like, what do we need? We put together what do we actually need, and then what do we think we can do? Would you agree?
Mark, go ahead. Give
Yeah,
us a little of the
100%.
history. A little of the history.
I will.
But the care,
yeah.
care court came first, and then, but with Prop 1 in the vision the whole time.
So it's I've shared this story before. When I interviewed for the job with Governor Newsom, I came up. I really hadn't been to Sacramento much, to be candid. I was a complete outsider. I didn't know any of the rules, which probably helped me, to be candid. And
He would frequently say, "That's above my pay grade."
yeah, and knowing that that's the best way to just move on through. But in that first conversation, he wanted to talk to me about single payer, and I wanted to talk to him about behavioral health. And I wanted to talk to him about the fact that I'd seen people arrested who really, for throwing a sandwich at a cop because they were sick, and decompensating in Men's Central Jail and our forensic inpatient unit, and suffering, horrible suffering that was unthinkable. And we didn't have a lot to do about it until in LA, I had the privilege of starting something called the Office of Diversion and Reentry, just celebrated its 10th anniversary. 99.5% of the folks removed from the forensic inpatient unit into community don't commit another crime, and they're stable in housing, a beautiful story. And I was telling him stories of the things that I had the privilege of doing in San Francisco and in LA, and that these could be the things and he said, yeah, but can you do the single payer piece? And I said, of course I can. That's not, we can talk about that. And we did that piece too, and talked about what that looks like for California, and put together a report that I don't think many people have read since, but such is life. But I think that really formulated a shared conversation. At the end, he told me his stories about why behavioral health and mental health, and I say behavioral health very specifically because I think he and I were on a mission, at least through our executive branch, to change the conversation from mental health here, SUD there. We got to talk about them together. And his formative moments in this space really were around SUD even more than mental health. So there was that shared partnership. And then two other things happened, I think, that really strengthened he and I's connection on this issue. One, the homelessness crisis that came squarely. I think about it. It was always at the state's doorstep. He just happened to answer the door in a different way and took it on in a different way. And so my sort of that connection between health and homelessness, and had the privilege of doing something called Housing for Health in LA as well, that challenged the idea that homeless sick people had to be in the hospital without being housed. And I know this is an old story, and California has gotten a lot better at it, and you have Margot coming to talk about it later on. But that was an interesting idea 15, 17 years ago. And now we're doing it more regularly. So really having a chance to talk to him about that. And then the real big accelerant for this was COVID, frankly. And it's funny, Marco, who I don't know is here yet. Is he here? I can't see who's here. Marco and I would talk about how COVID was the great accelerant for change. And so much of what we had the privilege to work on and do came because of the unmasking of a lot of the inequalities and inequities that we see across our state and across our nation. And then those couple of years where there was a surplus and we had a chance to say, let's get in line and ask to be able to do these things. So those were some of the most formative pieces. And then I'll tell just one quick story about Susan Eggman. When I knew I found the glove to work with, it was 6 a.m. I was taking my son to a baseball clinic, and I said, what the hell, let me call Susan. And she picked up and we talked for an hour while I paced outside of a baseball stadium, talking about what became some of the things she shared about. And I think that was important. We never actually had a restaurant or a coffee shop ever. It was all done by phone and a little bit of Zoom. So, that's where a lot of it came together.
Thank you for sharing that. I want to talk about implementation and conservatorship reform in care court and kind of combine them and take it for wherever you want. You heard my opening remarks where I was and remained a supporter of care court and your SB 43 conservatorship reform. But I want your reaction to my premise, because maybe I'm wrong, that there's far too much focus on the individual's responsibility and not nearly enough focus on the society's obligation to its governance to actually provide access to the care for people. Do you think there's too much emphasis on the individual's responsibility? And secondly, why is the uptake on care court, for example, so slow? Why are the numbers not what maybe many had hoped for at this stage? I know you still have hope, as do I. But what is it about some of those programs, even if they tend more towards the responsibility for the individual to comply, that isn't getting us at least the immediate results that we all want to see?
I will say, I think we put too much, I think for too long we put too much emphasis on the individual, both from the blame of the problem as well as the rights. Right? You know what I mean? I mean, on both sides. On both sides, we put too much emphasis on the individual. And that was a real attempt of care court, was to hold the government accountable, right? The $1,000 a day paid to counties, or counties would be fined if they didn't provide the housing or they didn't implement the plan, right? That's what we were saying. We're flipping the responsibility. What I have heard about some of the problems of implementation, and Mark probably knows a lot more, is I think some of the negotiations we engaged in to make it as permissive and as non-restrictive as possible, because there was a lot of, as you remember, there's a lot of pushback, a lot of, people didn't want it. Once we said court, then we tried to say act, but it was too late. Court was already out there. But there were allowances made that everyone had a public defender, which is good. You want people to protect their rights. But a lot of public defenders will say, don't agree. And so then there was no hook then to bring people in. I will say, I'm hopeful with Prop 43 going into effect, there will be a larger backstop. There will be a larger backstop.
That's the conservatorship
That's
reform.
the conservatorship, right? That's the conservatorship, that if people are not successful, and not that they would be referred from care court, but generally will end up back then in a situation where they found themselves in the first place, and then perhaps go from a conservatorship down into care court and then down into a regular FSP. I mean, they're the same people we're talking about a lot of the times on that continuum of care.
So, Mark, let me sort of repeat or restate the question. Is there too much emphasis in public dialogue and public policy on the responsibility of the individual to accept services and housing versus the government's responsibility to provide access to more people? And related, maybe related or not, why are the numbers not what we want to see when it comes to initiatives like care court or even the uptake on the SB 43 conservatorship reform?
So I could never sit up here with a straight face and say we've overemphasized the individual, right?
The responsibility.
And even that, because through, in my view, through deepened, stronger partnership, you get greater responsibility on both sides, right?
Both
that
sides.
partnership. And I think, part of the vision around Care Court, which really did shift in its sort of vision and name even over time, was to say we have this big gap that there are a lot of people with pretty significant behavioral health needs who willingly and easily find and access care. There is a group, right? And then there's a lot of people on the other end who don't, and they're the ones who end up in Men's Central Jail and the forensic inpatient unit across our state. And then there's a number of people who if we had the boldness to really engage and reach out, that we could probably prevent them from tipping into the bucket I think we don't want to see.
So where's the shortfall in the reaching out? Go ahead.
And I think what Care Court meant to do in many ways, and Susan said it, but I'll emphasize it again, is say we have these resources. They're not targeting this group of people as sufficiently or successfully. And so some account for government broadly. We often talked about counties, states, others, who is government, but that's who it is. I mean, it's those of us who have this obligation and took jobs to serve our safety net populations, of which this is one of the foremost, that we could maybe do things differently and engage differently with that partnership concept. So is there too much emphasis on the individual? I don't think so. But I do think we have to hold up our end of the bargain better. And that was the concept around Care Court. To address the numbers issue, I think what I just said is hard to turn around. A lot of people have really complicated jobs today. To go and say, hey, we're going to ask you to put these people at the front of the line. I remember legislative hearing after legislative hearing where I repeated that. I said, this is a group of folks that today they're not even in the line. The folks that we're trying to target with Care Court, let's put them at the front and find a way to focus on their housing, their behavioral health treatment needs, their other social supports, and let's wrap that around them with a lot of intention and in partnership. And that was the hope that we would see happen. And I think that's a hard thing to do. If I reflect on one thing, and it's easy to either beat yourself up or say you should have done, could have done this differently. But I think the way, and I'd love to hear both of your sort of views on this, sometimes legislation is really hard to move forward because if you broadcast too early, you get stopped in your tracks. And if you broadcast too late, you miss an opportunity to partner with some of the most meaningful people. And I think we didn't always hit the sweet spot on this, that we could have brought certain people in, like our county partners, like some of our disability right partners, who didn't feel like they were part of that conversation as strongly as they should have been, to really be able to have successful implementation. So if that piece could be sort of the tape rewound, I certainly would try to do it a little bit earlier in a way.
And if I could just tag on to that, and again, talking about not putting too much pressure on the individual, is the idea that, Lord, you get to that when our lack of partnership early on, I think we need to be careful that doesn't lead to further implementation problems. I am now find myself at one of our CSUs as a chair of a department, and the bureaucracy is staggering. And so as we are, oh Lord, and so as we are trying to implement this and working with our county partners, we have to make sure that we don't overburden it. And we talk about outcomes and all the things that we really must do to get that data, but we cannot overburden it with report after, just the bureaucracy will kill the whole thing. So I think as we roll this out, we really need to listen to our county partners, and the state must be much more nimbly involved to be able to go in and pinpoint when changes must be made and clear out blocks that exist still all across the system.
I really appreciate the acknowledgement, of what we all could do better, right? Because you look back and say, but these are hard issues. They were hard times, and you're moving fast, and it still really accomplished something. The question going forward is, how do we make it effective and make it even better? And I will say, I'm asking these questions about the responsibility of the individual versus society because in our movement, it continues to be a divide. And we have managed to sort of, dance with it and dance around it a little bit and maintain a room like this. But people feel very strongly and differently about this. And I think part of our work going forward is to find ways to bridge those gaps, right? And maybe that leads to, I don't know how much time we have left. I have till 4 o'clock, is that right? Is that 10 minutes? Okay, 10 minutes. 10 minutes left. All of these discrete and related initiatives, whether on the policy side or on the funding side, and maybe I'll start with Dr. Ghaly on this one. How do you envision a great system? I know you talked about, when your first conversation with the governor, you talked about single payer, and maybe single payer is the answer, maybe it isn't. But we have all of these initiatives, we have all these discrete systems, some would say, I said fragmented systems. How would you like to see all of this integrated? What's your vision going forward now of how the foundation you two have laid, will actually lead to a system where people get help early and where people get the level of help they need based upon the severity of their conditions?
So first off, I appreciate, and Susan, I'll speak for both of us, the acknowledgement of our role in it, but it's just everybody, and I really mean that, and that's the only way.
Modesty.
That this, yeah. No, but yeah. It's the you couldn't have it rest on a few people or even hundreds of people's shoulders. I think the honest truth is the only way that this system comes together is because everybody in this room and 150 rooms like this filled to capacity do their job and do it together, right? From city to county to block to community-based organization to church or synagogue to jail and prison to, Catherine Lucero's here and the Office of Youth Restoration and Community Restoration and Development. I think it's just important that we all see our piece in making that system work. I do think we have some real foundational roadblocks or barriers we have to get over. The workforce one is one of them. I think you can't imagine doing everything we've set out to do without the workforce that we have. I have, in my year since stepping away, thought a lot about some of these challenges and feel like we are now at a time where to invoke a little bit of HR1 and the forcing function that comes. I know it's hard and challenging to figure out a way through. A lot of people will lose things along the way, but hope can't be lost, right? We've got to pick our head up and keep pushing forward because the system is in reach. And then the second piece, and I talked to Tom Insel a bit about it, and many of you, that there's this role of technology and an opportunity, whether it's about cleaning up our data, making it more available, understanding the analytics better so we can be more targeted and smart, not just with our resources, but with the precious time of the people doing the work. How can it be a tool that helps expand the work of one person into a couple? We just have a lot of need, and I think the coupling of deeper partnerships among all of you, but I'm going to be very clear about the county and the state and strengthening that partnership, as well as bringing together important implementation tools, whether that's expanding the workforce or making our data and analytics smarter and better. I think that gives me a lot of hope because, frankly, Medi-Cal, our system of behavioral health, has been a little bit afraid, rightfully so, of technology. And where can it help us move the needle in a way where we desperately need the needle moved?
Can I add to that?
I would echo what Mark is saying 1,000% about the idea of hope, right? That idea that we are in some hard times now, but we've also at the end of some huge investments that we were able to make into the system, and I don't know that we'll be able to have huge investments anytime coming up. So it is behooves us as much as we can to really do the best that we can of implementation. And I can't say enough to remove as many bureaucratic barriers as we can. On the issue of workforce, I will say again, continue to have conversation where we all share the same vision, because I don't know that our conversations penetrate down through all the layers. Again, finding myself now back at a university, and I've got 3 programs that deal with workforce issue, and I don't think that people there's no connection between what the state is asking and funding and what universities and community colleges are providing, right, as far as producing the workforce. So I think there's a disconnect amongst some of our partners that we haven't engaged with as impactfully that we still need to do. But I think the idea that hopefully, despite the barriers, we have implemented with some resources. I know all over the place there are big projects going up to increase capacity in residential spaces, that we all share the vision that there will be, a treatment for anybody at any place at any time, and to be able to move back and forth on the continuum of care. Right? If we share that thought together, and that we're, the time of the Beatitudes, we're all in this together. We're all trying to provide the care and the coverage that we need, and get rid of the bureaucracy as much as we can, and be nimble. Then I think we do it.
Can I just add one last thing? I had the privilege of being asked to co-chair the Future of Medi-Cal Commission, and it set out to talk about a 10-year vision for Medi-Cal. And I think the health foundations that brought it together said, I think the thought was, we can remain under attack today, or we can prepare to future-proof Medi-Cal. And that includes this enormous behavioral health program that has been built up because of things like MHSA, BHSA, because of CalAim, because of BH Connect, because of CYBH, all of these things tie together. And it was interesting, in the very first comment in the breakout group I was in for the advisory committee to this committee that I'm co-chairing, and somebody stood up, and I didn't know her personally, but her comment resonated. She said, the 10-year vision should be, don't give us anything more to do, and let us just get these things done that you asked us to do. And I do think we got to be careful on scope creep, and we got to be careful because, it's not wasted on me. Look, we didn't let a minute go to waste. I feel like while I was working with Susan, Darrell, and many of you, and now people need the time to make it all work and make it all make sense. So I do think the next many years, if you don't see the major sea shift again, it's maybe a good thing to let us actually catch a breath and do it all.
So I should not ask the next question. What are your next 5 big initiatives? No.
I have those.
Implementation.
No, you got a few. So we have 5 minutes. So last question, I want to pick up on some of the strands that you have been talking about. Mark, you talked about strengthening the state-county relationship. And I want to take that and meld it with something else. How do we strengthen the state-county partnership and relationship? And let's add the providers there as well. And secondly, what does it mean to you when people say we need more of an outcome-based system, both on the payment side and on the result side?
Well, so partly, look, I spent more of my time in my career in county land than I did in state, right? And I get it. It's not an easy thing to cross over in anything. Medicaid's one part of it, but pick your thing, social services, the justice realm, homelessness. You saw it play out, Darrell, better than anyone as both city, state, thinking about your own county. and some of my comment is a reflection on my own leadership too, right? Knowing where counties are and where they come from. I probably didn't myself spend enough time figuring out how to cross that. And as I reflect on that, I think the evolution over the last many years is counties sort of took resources from the state. There wasn't a lot of infrastructure around accountability, whether it was around data, around outcomes, around staffing, around where you're spending your money. And that took up a lot of energy and created some friction when the state either discovered or were told by legislators and the public, like, what are you doing? County's got all this money, resources. We're not sure what you're getting out of it, because they themselves weren't. And that created some tension and friction. I think we got to move beyond that. We got to see the partnership moment where the state is saying, look, we have a role in holding you accountable. We have a role in figuring out what you're doing with the resources that we were given by our residents to then distribute locally. And how is that all going? And because of the evolution of the tools that we have today, I think that the state and the counties have a real bright future if we can figure out some of the small p and big P politics that go there to really work together in a very different way.
And Susan, what does the term outcomes mean to you? What is that?
I mean, the easiest way to explain it is you see real change in the person you're working for and with in their life, right? I mean, they're behavioral health, and I'm not the expert as much as I'm a pediatrician, so I can think about pediatric outcomes all day long. You all have taught me a lot about the behavioral health system outcomes, but I mean, the one important one, right? We talked a lot about first episode psychosis. We talked a lot about how the first episode, fine, we can understand. It's sometimes really hard to predict, although we're getting better at that too. But the second episode, that's something we can really prevent if we put all the right tools. And that's the kind of thing, like the change in people's lives that we want to see. And how do you measure that? And how do you ask people to spend their resources and their energy focused on that rather than did they follow up 7 days after X? Or did we get, I mean, those are nice measures that help you focus on outcomes, but that's why we call them process measures. And I think we've got to move beyond the process stuff to make sure that we're actually focused on the real life change that we care about.
Senator Eggman, last word.
Last words, I would just say, but because I think it is critical, the relationship between the state and the county. And I think just because, again, to put my social work hat on, just because we had a fractured relationship before, we can start fresh. We can start fresh and go forward and not blame each other for what happened, but really listen to each other on what needs to be done going forward to provide the services that we need.
I've always said, if you're a leader in the city, the county, the state, the school board, we all have the same constituents. And they actually don't care who's responsible for what. They just want it to be better. And so we always have to step back and say, it's not us versus them. We all represent the same people. Thank you so much for all your leadership
Thank you.
and your insights today. Really appreciate it.